On to our 6.7, our 1015 Lake County Department of Health Services monthly update. And with that, Director Jonathan Portney, if you're, yep, he's right there. So I will go ahead and give the floor to you.
Good morning, supervisors. Good to be with you. Today, I was hoping to touch on a different aspect of our health services department in a grow. But I also just want to emphasize the importance of checking in and stating that, COVID is still here and we are seeing an increase in test positivity rates in our county, and also highlight that monkeypox is still a lingering and growing concern within the health industry. So more to report on those. But today, I want to create a special place for a special partnership in person. And I have Larry Karstead here today with our North Coast EMS LIMSA provider. And over the past 7 months since I've been here, we've had many trials and tribulations when it comes to access to service delivery. And I just want to express appreciation to Larry, and I wanted to invite him to this space to share how far we've come in these 6 months and navigating a system with limited resources. So without further ado, Board of Supervisors, I invited Larry here to provide a brief update, and in the future, in a few months, his team is putting together a more comprehensive update. But I just wanted to create space to check in with a familiar face and name, and welcome Larry to the Board of Supervisors in Lake County. Thank you.
Thank you, Jonathan. Good morning, everybody. Pleasure to be here. The last presentation it was very important. Just as a side note, North Coast EMS has been very progressive for the last 6 years, maybe 7 years, in trying to marry EMS and behavioral health to help offload patients at emergency departments, which increasingly face too many behavioral health patients at the same time without medical issues. We're pleased that there is state funding. I think there's a total of $4 billion allocated within the state toward mental health issues over the next 4 or 5 years. So that's very exciting. And it's the first time in my very long career that this has happened. So we look forward to continue to work with our behavioral health colleagues as well. I'm Larry Karstead, Executive Director, North Coast EMS. As Jonathan just alluded to, we've been working with our partners in Lake County, Jonathan, Dr. McLaughlin, others, for several months to identify opportunities to enhance our services in Lake County, to review roles and responsibilities, to target common objectives. Our overall objective is to plan, coordinate, and evaluate the EMS system in 3 counties, Del Norte, Humboldt, and of course Lake County. We look forward to continuing to do that. We have a small but very effective team. In our capacity, we carry out statutes, regulations. We prepare annual EMS plan updates, write policies and protocols, medical for EMTs and paramedics to follow. We designate paramedic-based hospitals. Both facilities in the lake are so designated. One of those hospitals, Sutter Lakeside, is also a designated trauma center through North Coast EMS. And both facilities are somewhat uniquely designated by us as emergency departments approved for pediatrics, which means we've evaluated them, I think within the last year and a half, conducted a site survey to ensure they're pediatric ready. They have the right equipment, training, and so on in each emergency department. We're one of the longest, if not the longest, serving EMS agencies in the state of California. We have an excellent team. Dr. Matthew Karp is our medical director. He actually is an ED physician at Sutter Lakeside Hospital as well, and is in Santa Rosa. Our associate director has been with us 24 years, Wendy Chapman. Casey Hurd, our paramedic, is regional EMS disaster coordinator, is one of the longest serving paramedics in the North Coast region, although she's retired from active paramedicine. And I am the longest serving EMS director in California. I've actually served on behalf of Lake County for, I think, 34 years altogether now. Jonathan asked me to highlight a few recent successes. We recently submitted 5 EMS annual plan updates. That includes the overarching regional plan, the trauma plan, the STEMI cardiac plan, the quality improvement plan, and the EMS for children plan. Each of these are fairly comprehensive. They had gone out for public review. We had corporate input, and those are at the State EMS Authority for approval at this point. We recently, one of the CTs at one of the facilities in Lake County went down a few weeks back, and we assisted with clarification of patient destination issues surrounding the loss of that very important piece of equipment. I think that worked fairly well. You may be aware there's a drug shortage issue globally. It has to do with the war in Ukraine and other factors. And we're working, as we do, with all of our partners within 3 counties, Lake County as well, to look at alternatives to fentanyl and other controlled substances, and to provide guidance to our ALS providers in Lake County to ensure that they continue to be stocked or find alternatives to those potential shortages. And I mentioned the behavioral health linkage. We've been fairly, as I said, progressive in that regard. I should mention our fiscal picture. We have an annual budget roughly of $700,000 a year. Most of that is about 40% comes from the State EMS Authority. We have a MATI fund that the boards of supervisors adopted in each of the 3 counties at our request. We get a portion of that. That fund in Humboldt has been very large. I think they contribute about 40% total. Lake County's total contribution is around $35,000 annually. We're really excited. We're on the verge for the first time in well over 20 years. We could receive, it's in the governor's budget at this point, another almost more than doubling of our state general fund allocation. And it will really help us increase services, add staff. Jonathan and I have talked about at least housing staff, maybe rotationally, or someone that actually resides within Lake County if we can add staff, which we wanted to do for a long time. So if the governor signs the budget as is, that will be an annual increase of, I think, $255,000 to this office. That is huge. With resumption of in-person meetings, we look forward to being more present again. Obviously, there's been a pandemic and we haven't been traveling. But certainly if we receive this augmentation or other new revenue, we certainly would like to have a presence in Lake County, either consistently or more often in the future. And if we get this money, we certainly should see an increase in our services. So we're excited about that. We do look forward, as Jonathan mentioned, to coming back to the board in a month or month and a half, whatever is appropriate, to do a more comprehensive presentation, get into more detail about what we do, what some of the issues, common issues that we have that we're working on with our partners. And I think that's about it. And happy solstice to everybody.
You, Larry.
Be happy to entertain any questions.
Supervisor Sabatier?
Thank you very much for that presentation, and I'm looking forward to a deeper conversation in the future. I know that one of the things that you and I have been working on, Larry, as well as with health services and the fire districts, is discussing IFTs, the interfacility transfers. And I just I don't know that we have a permanent fix, but it definitely feels like we've alleviated some of the pains that we were dealing with at least 6 months to a year ago, where it was just taking too long to find an ambulance to be able to provide the service to another healthcare facility with higher level of care. So I appreciate the work that has been done, what's been approved, because I can see it and I can feel it in those that are working in the middle of all of that, that it's less of a frustration to make sure that we care for our patients. So I appreciate the work that's been done.
Yeah, this has been a group effort. It's a very, very long problem in Lake County and most rural areas in the state and technically in the country, I think. There just aren't enough specialty services within small counties like Lake County. They have a lot of people that need to be transferred out of the area to higher level facilities. There has been some good progress. I'm excited. I've seen a lot of folks come together, and if we continue to work together to ensure that there are more available ambulances for those interfacility transfers, I think that's part of the solution. And we certainly look forward to working with all of you to assist with that issue.
And just to add, the presence in Lake County, I think, will make a huge difference. It's not impossible to do great work when you're working from afar, but when you see what's happening and you can experience what's happening in a specific community, it's easier to be impassioned to make that change that's needed. And so I'm looking forward to that as well.
We are too. Thank you.
All right, so I'll go ahead and open it up for the public, if there's any questions or concerns on 6.7. All right, bring it back to the board. Is there any other, Vice Chair Scott? No, I see you writing something. Okay. All right. Anything else you'd like to add, Director Portney?
That concludes our time today. Thank you, supervisors. Thank you, Larry. Thank you, team, for joining us today and hearing us. Appreciate you.
My pleasure. Thank you all.
Thank you.
Thank you.